Gentlemen, for over 25 years, I've had the honor of accompanying thousands of men on their health journeys, especially as they enter the phase after age 50 or 55. I've listened to the most private concerns in my clinic, worries that many hesitate to share, even with their partners. Perhaps you're here today because you feel something is different? Does the fire of passion that once ignited so easily now seem to require more effort to spark? Is that feeling of confidence, of masculine strength, sometimes replaced by confusion, disappointment, even shame? You might ask yourself, what's happening to me? Is this the end of fulfillment? Let me be clear right from the start. Absolutely not. What you're experiencing, however uncomfortable, is not a personal failure. It's not your fault. It's part of a natural biological process. A new chapter your body is entering. And the most important thing I want you to remember after watching this video is, you have far more control and ability to improve this situation than you might think. In this video, we won't just scratch the surface. We will delve deep into the nature of these changes, both biologically and psychologically. We will dissect the seemingly harmless daily habits that silently erode your health and performance. More importantly, I will share practical, proven, and entirely natural strategies so you can regain control, restore confidence, and enjoy a more fulfilling intimate life, without relying entirely on medication. Without giving up, and certainly without feeling inadequate. Consider this a frank, open conversation among men, guided by medical experience and deep understanding. Together, we will pull back the curtain, equipping you with the knowledge and tools necessary not just to face, but to conquer the challenges of aging. Stay with me, because what you're about to discover could change everything, not just for your body, but for your confidence, your relationships, and your future. We'll begin by understanding what's really happening inside your body. Part 1. Decoding biology. Why does the machinery change? As the original transcript rightly mentioned, one of the most noticeable yet least talked about changes is the gradual decline in erection firmness and spontaneity. This isn't just a surface issue, it's deeply rooted in the biology of aging. The silent decline of testosterone. Let's start with the king of male hormones, testosterone. It's not only responsible for sexual desire, libido, but also influences energy levels, muscle mass, mood, bone density, and even cognitive function. Like a high-performance car, the male body needs testosterone to operate optimally. However, the reality is that after age 30, natural testosterone levels begin to decline gradually, averaging about 1% per year. Initially, this decrease might not be noticeable, but as you enter your 50s and 60s, this accumulation becomes more apparent. Lower testosterone levels often mean decreased libido. The fire of passion doesn't ignite as easily as before. Weaker erections. Difficulty achieving and maintaining the necessary firmness. Slower recovery. Needing more time to be ready again after intimacy. Mood changes. Increased irritability. Fatigue. Lack of motivation. Decreased muscle mass and increased fat, especially abdominal fat. Doctor's perspective. I want to emphasize that this is a gradual and natural process. Not everyone declines at the same rate, and the impact varies. Genetics, lifestyle, and overall health status all play significant roles. What's noteworthy is that many men mistake the symptoms of low testosterone for normal signs of aging and passively accept them. But you don't have to. Identifying and addressing low testosterone, if present, is a crucial first step. We'll discuss tests and solutions later. Blood flow issues, the pipeline to erection. Essentially, an erection is a vascular event. Imagine the penis as a complex structure with cavernous bodies, corpora cavernosa, like sponges. For an erection to occur, stimulation signal. The brain sends signals via the nervous system. Vasodilation. Small arteries carrying blood into the penis must significantly relax and widen. This is controlled by a miraculous molecule called nitric oxide, NO. NO signals the smooth muscles in the blood vessel walls to relax. Increased blood flow. Blood rushes in to fill the cavernous bodies. Vein compression. As the cavernous bodies fill and swell, they compress small veins, preventing blood from flowing out, thus maintaining the erection. So, what hinders this process as we age? Loss of blood vessel elasticity. Over time, Like an old rubber band. Blood vessels become less flexible, stiffer. This process is called atherosclerosis, and it happens throughout the body, but particularly affects small blood vessels like those in the penis. Endothelial damage, the innermost lining of blood vessels, called the endothelium, is where nitric oxide is produced. Factors like high blood pressure, high cholesterol, diabetes, and smoking damage this lining, like rusting a water pipe. When the endothelium is damaged, the ability to produce NO significantly decreases. Plaque buildup. Bad cholesterol, LDL, and other substances accumulate as plaque inside the arteries, narrowing the diameter and obstructing blood flow. Imagine water trickling weakly through a clogged pipe. Decreased nitric oxide production, even without obvious damage. The natural ability to produce NO also gradually declines with age. Real-life example, U.S. culture. Think about John, a 58-year-old sales manager in Chicago. He has a stressful job, frequently eats out, steaks, fried foods, drinks a few beers after work, and has no time for exercise. In recent years, he started having difficulties in the bedroom. When he came to see me, tests showed high cholesterol, slightly elevated blood sugar, prediabetes, and borderline high blood pressure. This is a very typical scenario. These seemingly normal American habits were the factors silently damaging John's blood vessels, leading to erectile dysfunction, ED. John's problem wasn't just age, but the cumulative consequence of a lifestyle directly impacting his vascular system, the foundation of an erection. Nitric oxide, the on-switch molecule. As mentioned, nitric oxide, NO, is key. It's not laughing gas, nitrous oxide, N2O, but a critically important signaling molecule. Upon sexual stimulation, the nervous system releases NO into the smooth muscles of the penile blood vessel walls. NO activates an enzyme called guanylate cyclase, which produces a substance called cGMP, cyclic guanosine monophosphate. It is cGMP that relaxes the smooth muscle, widens the arteries, and allows blood to flood in. Common ED medications like Viagra, sildenafil, and Cialis, tadalafil, work by inhibiting another enzyme called PDE5. This PDE5 enzyme's job is to break down cGMP. By blocking PDE5, these drugs help maintain higher levels of cGMP, prolonging the vasodilation effect and supporting erections. Why is this important? Because it highlights the significance of maintaining natural NO production. Age, cardiovascular disease, diabetes, smoking, and poor diet all reduce the body's ability to produce and utilize NO. Doctor's perspective. Understanding NO helps us see that improving overall vascular health is crucial. Eating foods that support NO production. We'll discuss this more in the nutrition section. Exercising regularly, which helps improve endothelial function, and managing underlying health conditions are natural ways to boost this NO switch. 1.4. The nervous system, the signal transmission line. The arousal process starts in the mind, through desire, memory, touch, imagination. This signal must travel from the brain, down the spinal cord, and through nerves to the penis. As we age, the nervous system can also react a bit slower. Like an old internet connection, signals take longer to travel from point A to point B. Sensations might feel less intense. The time between thought and physical reaction lengthens, requiring more stimulation, more time, and more patience. Furthermore, nerve damage due to diabetes, peripheral neuropathy, pelvic surgery, like prostate surgery, or other neurological conditions can also directly interfere with the transmission of signals necessary for an erection. Doctor's perspective. This is why foreplay becomes more important than ever as you get older. It takes time and focus to wake up the system. Open communication with your partner about what feels effective and what needs to change is also key. Part 2. The psychological battle, when the mind obstructs the body. As the video indicated, many men believe physical decline is the only reason, but the truth is the psychological component is just as important, sometimes even more so. 2.1. Stress, the silent enemy. In modern society, especially in the U.S., we live in a high-pressure environment, demanding jobs, financial worries, family issues, health concerns. When you're stressed, Your body activates the fight or flight response. The adrenal glands pump out cortisol, the stress hormone. In the short term, cortisol helps you deal with danger. But when stress becomes chronic, cortisol causes harm, inhibits testosterone. Cortisol and testosterone have an inverse relationship. Chronically high cortisol will decrease testosterone production, increases blood pressure. Cortisol constricts blood vessels and increases heart rate. Reduces nitric oxide. Chronic stress impairs endothelial function and no production. Affects the mind. Causes difficulty concentrating, anxiety, and reduces sexual desire. Real-life example, U.S. culture, Mike, a 60-year-old small business owner in California, is facing significant economic pressure. He suffers from insomnia and constantly feels anxious. Although his physical health is reasonably good, he notices his sex life has severely declined. Mike's problem isn't initially with his blood vessels or testosterone, but with sky-high cortisol levels from prolonged financial stress. It's silently sabotaging his endocrine and vascular systems from within. 2.2. Performance anxiety. This is an incredibly common and devastating psychological trap. It starts with a thought. What if I can't perform? What if I disappoint her? When you start worrying, your brain shifts from a state of relaxation and pleasure, governed by the parasympathetic nervous system, necessary for erections, to a state of alertness and pressure, governed by the sympathetic nervous system, causing vasoconstriction and inhibiting erections. It creates a vicious cycle. You worry about potential failure. The anxiety activates the sympathetic nervous system, releasing adrenaline and cortisol. These hormones constrict blood vessels, preventing blood flow into the penis. You fail to get or lose an erection. This confirms your initial fear, making you even more anxious for the next time. Doctor's perspective. This is why I always tell patients, the harder you try, the more likely you are to fail. Erections require relaxation, not pressure. Understanding that the mind and body are intimately connected is a turning point. The issue isn't a physical malfunction, but the mind sending the wrong signals to the body. 2.3. Social pressure and relationships. American culture often places heavy emphasis on the male role as provider. Strong. Experiencing sexual difficulties can be perceived as a sign of weakness, severely damaging self-esteem. The pressure to perform anytime, anywhere can be immense. Furthermore, a lack of open communication with a partner about these changes can lead to misunderstandings, feelings of rejection, or unspoken pressure, further exacerbating the problem. Doctor's perspective. It's crucial to redefine intimacy. It's not just about erections or intercourse. Touch, cuddling, loving words, emotional connection are also incredibly important parts of a fulfilling relationship. Talk to your partner. Share what you're going through, your worries. Their understanding and support can be the most powerful medicine. Part 3. Lifestyle, the bricks that build, or break, the health foundation. The video emphasizes that many difficulties after 55 don't stem from age alone, but from the accumulation of daily choices. This is where we need to re-examine seemingly harmless habits. 3.1. Sedentary lifestyle. Sitting for hours every day, at a desk, in a car, in front of the TV, is a silent killer for vascular and hormonal health. Reduced blood circulation. When you don't move, the heart doesn't need to pump strongly. Blood circulates slower, especially to the extremities and pelvic region. Weakened cardiovascular system. Heart muscle weakens. Blood vessels become less elastic. Reduced testosterone. Physical activity, especially resistance training, stimulates testosterone production. Sitting too much reduces this signal. Weakened pelvic floor muscles. Muscles supporting erectile function and urinary control weaken. Weight gain, especially abdominal fat, which is linked to inflammation and insulin resistance, both detrimental to erectile function. Doctor's perspective. Research clearly shows the link between sitting time and ED risk. A Harvard study found that men who engaged in aerobic exercise equivalent to 3 to 5 hours of brisk walking per week had about a 30% lower risk of ED compared to sedentary men. Just getting up and walking around for a few minutes every hour makes a difference. 3.2. Diet, fuel for the engine. What you put into your body directly impacts your vascular health, inflammation levels, and hormone production. The typical American diet often contains many enemies. Processed foods and fast food, high in trans fats, unhealthy saturated fats, refined sugars, salt, and chemical additives. They cause systemic inflammation, damage the vascular endothelium, increase bad cholesterol, and promote atherosclerosis. Fried foods. Frying at high temperatures creates inflammatory and oxidative compounds that damage blood vessels. Sugar and sweets cause insulin spikes, leading to insulin resistance and type 2 diabetes over time. Excess sugar also promotes inflammation and reduces NO production. Processed red meat, such as sausages, bacon, often high in salt and preservative nitrates that can convert into harmful compounds. Real-life example, U.S. culture. A typical American lunch might be a large burger, fries, and a soda. Dinner could be pizza or a heated frozen meal. These meals, repeated over and over, are like putting sand in your car's engine. They slowly clog the pipes, blood vessels, and weaken the system. 3.3. Alcohol, relaxation or sabotage? A small glass of wine might help relax, but drinking too much and too often has negative effects. Depresses the central nervous system, reduces desire and sensitivity. Dehydration. Affects blood volume and flow. Interferes with hormones. Can lower testosterone and increase estrogen over time. Liver damage. Affects hormone metabolism. Nerve damage. Chronic heavy drinking can cause peripheral neuropathy, affecting erection signals. Doctor's perspective. Weekend impotence is a real phenomenon, occurring when excessive drinking on Friday or Saturday night leads to difficulty achieving an erection. Although temporary, it shows the direct impact of alcohol. The recommended limit for men in the U.S. is no more than 2 standard drinks per day. 1 drink equals 1 can of beer, 1 small glass of wine, or 1 shot of spirits. 3.4. Smoking, the blood vessel destroyer. There's no debate. Smoking is one of the worst things you can do for your vascular health and erectile function. Vasoconstriction. Nicotine instantly constricts blood vessels. Endothelial damage. Thousands of chemicals in smoke directly destroy the endothelium. Reducing NO production. Promotes atherosclerosis. Accelerates plaque formation. Reduces blood oxygen. Carbon monoxide in smoke displaces oxygen on red blood cells. Doctor's perspective. Studies show that male smokers have double the risk of developing ED compared to non-smokers. The good news is, quitting smoking can significantly improve erectile function, especially in younger men and those without severe pre-existing vascular damage. It's never too late to quit. 3.5. Sleep, the recharge and recovery time. In our 24/7 world, sleep is often treated as a luxury, but lack of quality sleep is a major blow to men's health. Hormonal disruption. Most testosterone is produced during deep REM sleep. Sleep deprivation significantly reduces testosterone levels. Poor sleep also increases cortisol. Reduced NO production. Sleep is necessary for restoring endothelial function and NO production. Increased inflammation. Chronic sleep deprivation increases inflammatory markers in the body. Affects mood and energy, causes fatigue, irritability, and reduced desire. Doctor's perspective. Just 1 week of insufficient sleep, e.g. 5 hours per night, has been shown to reduce testosterone levels in healthy young men by an amount equivalent to aging 10 to 15 years. Prioritize 7 to 9 hours of quality sleep per night. It's not laziness, it's an essential investment in your health. Summary of Part 3. Your daily habits, how you move, what you eat and drink, whether you smoke or get enough sleep, form the foundation of your health. The good news is these are all changeable factors. Even small, consistent adjustments can make a big difference. Part 4. Rebuilding the foundation, the natural toolkit. This is the most exciting part. What you can do to improve the situation. Starting today. 4.1. Smart movement. More than just sweating. Movement is potent medicine, but it doesn't have to be grueling workouts. Brisk walking. Aim for at least 30 minutes a day, most days of the week. It improves cardiovascular health, increases blood flow throughout the body, including the penis, helps manage weight, and reduces stress. It's a simple yet effective foundation. Strength training. 2 to 3 sessions per week. focusing on compound exercises like squats, deadlifts, lunges, bench presses, rows. These exercises engage large muscle groups, stimulate natural testosterone production more effectively, and build core strength useful for sexual activity. Kegel exercises for men. This is the often overlooked secret weapon. These exercises target the PC, pubococcygeus, muscle and other pelvic floor muscles, the ones you use to stop urination midstream or control ejaculation. Benefits: increases blood flow to the penis, improves the ability to trap blood in the corpora cavernosa, leading to firmer, longer-lasting erections, enhances ejaculatory control, increases sensation. How to do them? Identify the PC muscle by trying to stop the flow of urine midstream. Then, when not urinating, squeeze this muscle, hold for 5 seconds, then relax for 5 seconds. Repeat 10 to 15 times, 2 to 3 times a day. You can do them anywhere, sitting at work, driving, watching TV. Consistency is key. Doctor's perspective: combining aerobic exercise and strength training is ideal. Don't forget to warm up and cool down. Most importantly, find an activity you enjoy and stick with it. Exercise isn't just good for the body, it's also a stress reliever. Improves sleep and boosts confidence. 4.2. Optimal nutrition. Eating to flip the switch. Food is medicine. Make your plate a powerful ally. Boost nitric oxide. No. Dark leafy greens, spinach, kale, arugula, romaine lettuce are rich in natural nitrates that the body converts to NO. Beets. Another excellent source of nitrates. Beetroot juice is a popular option. Watermelon. Rich in L-citrulline, an amino acid the body converts to L-arginine, a precursor to NO. Garlic. Contains allicin, which helps improve blood circulation and may increase NO production. Dark chocolate. Varieties with 70% cacao or higher contain flavonoids, antioxidants that help protect the endothelium and increase NO. Nuts and seeds, especially walnuts, almonds, pistachios, contain L-arginine, healthy fats, essential for testosterone production and reducing inflammation. Monounsaturated fats, extra virgin olive oil, avocados, nuts, omega-3 fatty acids, fatty fish, salmon, mackerel, herring, sardines, flax seeds, chia seeds, walnuts. Omega-3s help reduce inflammation, improve endothelial function, and balance hormones. Antioxidants protect blood vessels from free radical damage. Berries, blueberries, strawberries, raspberries, rich in anthocyanins. Colorful fruits and vegetables, oranges, citrus fruits, tomatoes, bell peppers. Zinc, an important mineral for testosterone production, found in oysters, lean red meat, poultry, legumes, pumpkin seeds. Vitamin D, as mentioned, linked to testosterone. Good sources include fatty fish, egg yolks, fortified foods, and sunlight exposure. Doctor's perspective: think about the Mediterranean diet, rich in vegetables, fruits, whole grains, legumes, nuts, olive oil, fish, and limited in red meat, sweets, and processed foods. This eating pattern has been proven excellent for cardiovascular health and can improve erectile function. Don't try to change everything at once. Start by adding more greens to your meals, swapping processed snacks for fruit or nuts. 4.3. Taming stress, calming the mind. You can't have a relaxed body if your mind is racing. Learning to manage stress is crucial. Deep breathing, a simple yet effective technique to activate the parasympathetic nervous system, the rest and digest system. Practice. Sit or lie comfortably. Place one hand on your abdomen. Inhale slowly and deeply through your nose, feeling your belly rise. Hold for a few seconds. Exhale slowly through your mouth, feeling your belly fall. Repeat for 5 to 10 minutes daily or whenever feeling stressed. Box breathing, inhale 4s, hold 4s, exhale 4s, hold 4s is also very effective. Mindfulness and meditation helps you become aware of thoughts and feelings without getting carried away by them. Reducing anxiety. Many guided meditation apps, like Headspace, Calm, can help you start. Even just 5 to 10 minutes a day. Spending time in nature, walking in a park, sitting by a lake, Research shows nature has a calming effect on the nervous system. Movement. As mentioned, exercise is a great stress reliever. Social connection. Spend quality time with friends, family, loved ones. Laughter and social support help lower cortisol. Adequate sleep. Sleep is the foundation for coping with stress. Doctor's perspective. Stress management isn't about eliminating stress entirely, that's impossible. But learning to respond to it more healthily. Find techniques that work for you and practice them regularly. 4.4. Other natural techniques. Some complementary methods can support local circulation. Gentle penile massage. Stimulates local blood vessels and tissues. Perform gently, not for sexual stimulation but to enhance tissue health. Warm compresses. Applying a warm towel or heating pad to the lower abdomen or inner thighs may temporarily help dilate blood vessels. Hydrotherapy. Alternating hot and cold water in the shower can help train blood vessels to constrict and dilate. Doctor's perspective. These techniques are generally considered supportive, not primary solutions. They can be helpful when combined with core lifestyle changes. Be patient and consistent. Part 5. When to call for backup, partnering with your doctor. Sometimes, despite best efforts with lifestyle changes, results aren't as expected. That's perfectly okay and doesn't mean you've failed. There might be underlying medical factors that need addressing. This is when it's time to seek professional help. 5.1. Signs you need to see a doctor. Don't hesitate to seek medical advice if erectile problems persist over 3 to 6 months, despite positive lifestyle changes. There's a sudden drop in libido, energy, or mood. Other symptoms appear, such as pain or numbness in the penis or pelvic area. Erection quality negatively impacts your relationship or self-esteem. You suspect you have underlying conditions like uncontrolled diabetes, heart disease, or high blood pressure. Doctor's perspective. Seeing a doctor, family physician, urologist, or endocrinologist is not a sign of weakness, but a responsible and proactive step to better understand your body. Erectile dysfunction can be an early warning sign of underlying cardiovascular disease, as the penile arteries are smaller and often affected first. Consider it a potential canary in the coal mine for your overall health. 5.2. Common tests. Your doctor will take a detailed medical history, ask about medications you're taking, and perform a physical exam. Tests may include blood tests. Testosterone, total and free, assesses hormone levels. Should ideally be drawn in the morning when levels are highest. Fasting blood sugar and HbA1c. Screens for diabetes or prediabetes. Lipid panel. Checks cholesterol, LDL, HDL, triglycerides. Assesses cardiovascular risk. Thyroid function, TSH. Thyroid disorders can affect libido and energy. Prolactin. High prolactin levels can suppress testosterone and desire. Complete blood count, CBC. Liver and kidney function. Assesses overall health. Urine test. Checks for signs of diabetes, kidney disease. Note: the original text mentioned more advanced tests like Doppler ultrasound. Neurological testing, NPT. These would typically follow initial bloodwork if needed. Based on the examination and test results, your doctor might discuss the following options. Treating underlying conditions. The top priority is managing high blood pressure. Diabetes, high cholesterol effectively. Note: the original text detailed medical treatments like TRT, PDE5 inhibitors, injections, etc. A full translation of those detailed options would follow here if needed. Always emphasizing physician guidance and avoiding self-medication. Part 6. Synthesis and action. Taking back control. We've journeyed quite far, from understanding the biological and psychological changes, identifying lifestyle factors, exploring the natural toolkit, to knowing when to partner with your doctor. Now you know the truth. Erectile issues after 55 are not the end of the line. They are a signal, a call from your body that it needs more care, more attention, and a different kind of strength, the strength that comes from understanding and purposeful action. Key takeaways to remember. Movement is key. Just 30 minutes of walking daily can change the circulation game. Strength training boosts testosterone. Kegels are the secret exercise. Food is medicine. What you eat directly builds or breaks blood vessels and hormones. Prioritize whole foods, greens, fruits, healthy fats. Limit processed foods, sugar, bad fats. Peace of mind is power. Chronic stress and anxiety are enemies. Learn to relax, breathe. Practice mindfulness to pave the way for optimal body function. Sleep is restoration. Deep sleep renews hormones, repairs tissues, and resets the nervous system. Don't underestimate the power of sleep. Overall lifestyle. Moderate alcohol. Quit smoking are crucial decisions. Medical care is wisdom. Seeking help when needed is strength, not weakness. Don't self-medicate. Final advice. You don't need to be perfect overnight. Start with small, but consistent steps. Today, walk an extra 10 minutes. Choose a salad instead of fries. Breathe deeply for 5 minutes. Turn off screens 30 minutes earlier for sleep. This week, plan 2 strength training sessions. Try a new heart-healthy recipe. Talk openly with your partner. This month, schedule a regular health checkup if you haven't already. Do it not just for performance, but for overall health, for confidence, for joy and connection in your life. You deserve to enjoy the coming years to the fullest. Knowledge is power, but action creates change. You have the knowledge, you have the tools. Now, the choice is yours. Move forward with clarity and determination. Your best years don't end at 55. They can begin with the choices you make. Starting today. Thank you for your time. Take good care of yourself.